Currently, Hala is the chairperson of the nursing department at Jinan University, Lebanon, and she is always engaged in continuous learning to broaden her knowledge and experience in virtual learning and nursing education. Hala is looking for a vacancy to apply for a PhD program. She will be discussing inquiry-based learning in nursing education, educators' perspective on integrating inquiry pedagogy and its effects on critical thinking. Please join me in welcoming Hala.
Thank you, Dr. Malak, for your introduction. Good morning. It's my pleasure to be here in this conference and a great pleasure for me to attend this important event. I would like to thank all the organizers for kindly inviting me to this important event. So my research title is Inquiry-Based Learning in Nursing Education, Educators' Perspective on Integrating Inquiry Pedagogy and its Effects on Critical Thinking. I will start.
Can I stop you a little bit? Can you share your screen and the PowerPoint view? Because we're not able to see the entire screen. Sorry for that.
No problem. Is it better like this?
Yes, yes.
Okay.
Yes.
Okay, so I will start with an old saying. Tell me I forget, show me I remember, involve me I understand. The last of this statement is the essence of inquiry-based learning. Students, rather than learning passively from their educators and memorizing facts, construct their own understanding and knowledge. So let's see what's the background of this study. Both Emerson, Hackney, and Sutter 2016 stated that nursing education encompasses both the profession of nursing and the profession of education. In the nursing academia industry, the area of nursing practice expands beyond direct patient care to involve developing students for nursing practice by preparing nurse educators to serve as educators, researchers, and have the experience in the clinical specialty area. Brandon and al. 2010 stated that nursing curricula should be student-centered, interactive, and innovative, where students are able to think critically, formulate information, connect ideas, and able to become self-directed, far away from only memorizing knowledge. And as you can all see today, the nurse's role are changing to complex tasks that need high-order thinking skills. So the American Association of Colleges of Nursing and the National League of Nursing Accredited Commission stated that critical thinking is a crucial skill for nursing students and motivates nursing programs to integrate innovative teaching strategies as ways to boost the students' learning. Unfortunately, there are still many nursing institutions that are using traditional teaching methods with considering lecturing as the basic method of instruction. The concept of inquiry-based learning is referred to the ancient Greece time to the time of Socrates. Socrates, who is known as the founder of inquiry in education, and he's famous for his questioning technique to seek knowledge. Inquiry-based learning is based on constructivism theory, which argues that people can progress their own knowledge through integrating their own experiences and their own ideas with the environment around them. And there are a lot of constructivist theorists, like Piaget, a typical influencer of constructivism theory, recognized learning as a student's active approach. Brenner furnished to constructivism with his theory of discovery learning, and he declared that a student can reach the highest level of understanding by being engaged through problem solving and inquiry. John Dewey observed the concept of learning by doing, and in 1910 he determined a kind of thinking which he named the reflective thought that was later on spread and known as critical thinking, and many other constructivist theorists that focused on using active teaching approaches that enhances students' critical thinking skills. What is inquiry-based learning? Inquiry-based learning falls under the domain of inductive approaches to learning and teaching. Inductive approaches to learning and teaching starts with a set of data to be analyzed, or an observation, or a real complex wordy problem. And as students start to analyze these observations or these problems, they create the need for facts, strategies, and directing principles. Inquiry-based learning is an active approach to teaching and learning. It's a student-centered approach where the educator or the teacher is a facilitator. It's based on seeking knowledge and new understanding. It's a move towards self-directed learning. And as many research have shown, there are a lot of benefits behind using this active teaching approach. There will be higher level cognitive interaction, longer term knowledge retention. It increases students' motivation, enhances students' creativity, and there will be a more clear self-efficacy in addition to developing reasoning skills, problem-solving skills, and self-directed skills. On the other hand, there are many challenges that prevent educators from applying these active teaching approaches, like the lack of training and professional development of educators, the lack of institutional support to change their teaching methods and implement active ones, difficulty in managing classrooms. Some educators have a weak content knowledge and they miss the technological expertise. Others miss how to scaffold the inquiry to maintain learners' needs. As for a definition of critical thinking, is not like IBL, a method to be learned. It's a process and orientation of the mind and includes both the affective and cognitive domains of reasoning. Critical thinking from long time ago is considered a vital core skill in nursing education and nursing practice. And nurses should enhance their thinking and reasoning abilities in order to be able to evaluate effectively the value and application of new knowledge. And when we say nurses students' critical thinking skills, is their ability to think, apply, analyze, synthesize, and evaluate. And for sure, in order to enhance our students' critical thinking skills, we need to use an active teaching approaches such as IBL, case studies, inquiries, simulations, role plays, etc. One more thing, we have to know that in order to evaluate critical thinking skills, we need to use commercial standardized instruments. And these tests are not specific for nursing as a discipline. However, they have been used in research to test cognitive skills of students. The 5 most used critical thinking instruments are the Watson and Glasser critical thinking essay, the Cornell test of critical thinking ability, the Ennis-Wire critical thinking skill essay, the California critical thinking skills test, and the California critical thinking decision inventory. Statement of the problem. The clinical placement model that is long time used, where recitation, dialogue, memorization were followed by clinical practice, is not anymore effective in developing nursing education and nursing practice. Unfortunately, as I have said, there are many nursing institutions that are focusing on traditional instructional methods, lacking the ability to involve their students in their learning process and develop their high-order thinking skills to be able to work effectively in the ever-changing environment, or in what we call it today, in the explosion of information. And the researchers' experience as being a nursing student in a public university and a nurse educator in several nursing institutions reveals also the necessity of fundamental transformation in the nursing instructional framework. And this is related to several reasons. Some of them, the courses in the nursing curricula consist of a huge amount of knowledge, which directs educators to practice lecturing to finalize the content of the material during the time frame given. 2, nursing institutions focus on preparing their students, whether they are vocational students or bachelor students, for the official exams or the colloquium exams, which directs students to practice memorizing to pass these standardized tests. 3, students are resistant to change because they are adapted to traditional teaching methods starting from their school, continuing in their university level. So they prefer to have the material ready, memorize it, and pass their tests. This is why there is a need for preparing 21st century students. And this cannot be achieved without introducing innovative teaching strategies, such as IBL, one of the most innovative teaching strategies stemmed from problem-based learning, which changes educators from being the sage on the stage to the guide on the side. And this is why, and here I will mention the research questions and the purpose of the study. This is why it's worth to study and investigate to what extent do nurse educators employ IBL? And what are the challenges that prevent them from applying this active teaching method? To determine what is the correlation between educators' employment of IBL and the development of students' critical thinking skills, and to know the difference between critical thinking skills between students who are taught through inquiry and those taught through traditional teaching methods. And this is what we will see in the methodology. This research is considered a sequential explanatory design. The researcher started with a quantitative data collection and analysis, followed by a qualitative data collection and analysis. The researcher conducted a study on a sample of 275 nurse educators and nursing students. In the first step, the researcher visited 9 nursing institutions in 2 regions in Lebanon, Beirut and Saida, where 6 out of these 9 nursing institutions agreed to participate in the study. So 158 educators who were teaching technical and academic nursing students entered this study using the census method. In step 2, the researcher chose 2 out of 6 nursing institutions to conduct a study on 117 second and third year nursing students. In institution A, there is a use of IBL, and in institution L, there is absence of IBL and there is traditional teaching methods. Number of students in both institutions were very similar. As an instrument, the researcher used a survey questionnaire of standardized items that was used in the MASL project 2014. This is a large-scale report in the European partner countries about the inquiry-based learning implementation and distribution. This survey is composed of 48 items divided into 4 sections, adapted on the basis of the PISA study 4-point Likert scale, where there is no neutral response. The survey was used for educators as well as for students. First, it was used for educators to target their perception toward inquiry, to know their activities they use in their classes, their connections to the world of work, and the challenges that face them. The same questionnaire was used for students with some word modifications to target their perception toward inquiry and to compare the students' answers with their educators' answers. The researcher also purchased a license of the Cornell Critical Thinking Skills Test, Level Z, which is specified for higher education, Robert Ennis and Jason Millman, 2005. This is an intellectually challenging, standardized 52-item multiple choice instrument administered over 50 minutes to test cognitive skills. The items are based on common topics intended to be of short discipline, neutral statement, and scenarios, and they are grouped among the 6 aspects of critical thinking: induction, deduction, credibility, observation, assumption, and meaning. Let's see what were the results. So we have 158 nurse educators who were teaching in 6 nursing institutions. 75.9 were females. 57.6 were between 20 and 40 years, 44.3 were holding a master's degree. The surprise was that 68.4% of the educators answered that they have never been trained to teach, and this is a big problem. 64.6 of the sample in Lebanon disagree about regularly doing projects using IBL. 62 of educators disagree that IBL is part of the daily teaching. 70.5% never or hardly ever apply activities related to IBL. Hence, the majority of nurse educators in Lebanon are not implying IBL in nursing education. And these results do not conform with the previously mentioned research outside Lebanon, like Harimana and Debir 2013. They stated that most of nurse educators were using active learning approaches, including IBL, and 70% of the total nurse educators agreed that the basic objective is to enhance learners' knowledge and skills through interactive teaching methods. In order to determine the correlation between employment of IBL and the development of students' critical thinking skills, a chi-square test of independence was calculated to determine each of the students' questionnaire items with the educators' questionnaires items in the 4 aspects of the survey. And the result shows that there is a positive correlation regarding that reaches 25% regarding the real use of IBL of students and educators, 20% for the activities they do in their classes, 14% for their connections to the world of work, 10% for the challenges. So the positive correlation determines that there is a direct implication of inquiry-based learning on critical thinking skills. The researcher also calculated the p-value. However, the p-value was less than 0.05, and maybe not having the significance all the time is that critical thinking could be, or inquiry-based learning could be not every time the main factor that enhances critical thinking skills, and there could be other factors that affect this achievement. Also, a chi-square test of independence was calculated between the 6 aspects of the Cornell test, as we can see here, the 6 aspects of the Cornell test and the 4 sections of the survey. And the result shows that there is a positive correlation regarding the 6 sections of the Cornell test and the real use of IBL activities done in the classes, connections to the world of work, and the challenges. Moreover, if we can see here, the result shows that there is a strong association between the induction abilities and the challenges facing educators, and between students' observation, credibility, and meaning abilities, and the real use of IBL, and the assumption abilities and the connections to the world of work at p-value less than 0.05. Hence, we can accept the null hypothesis, the alternative hypothesis, and say that there is a significant effect on IBL on boosting nursing students' critical thinking skills. And for sure, these results come hand in hand with the previously mentioned research outside Lebanon, like Azizi Fina and Atib Hajbagari 2015, stated that nursing students who were taught in programs content show low critical thinking skills on the California Critical Thinking Skills Test. And here they have been used another instrument, but it's for testing critical thinking skills. The same for Kadura 2011, he stated that the mean California Critical Thinking Skills Test total scores for the students in competence-based learning was higher than those in lecture-based programs. The results also shows that 71.11% of nurse educators believe that many challenges face them upon implementing IBL in nursing education. And these challenges are grouped under difficulties at the micro and macro level. The challenges are related to many reasons, like the time constraints, students, they don't like IBL, the curriculum of nursing institutions do not encourage IBL, nurse educators are worried about managing classrooms, there is a lack of teaching materials, lack of educators training. So these are very similar to what we have seen. The results also of the interviewees in the qualitative part also reveals that there are many challenges that prevent educators from using IBL, like the large number of students cultures that refuse the change, the lack of materials and technology, the heavy curriculum, the absence of educators training, and both results in the qualitative and the quantitative phase comes hand in hand with other research outside Lebanon that have shared similar challenges that face educators. Hence, we can conclude that the majority of nurse educators complain of obstacles that prevent them from applying IBL. As to measure the difference between critical thinking skills, or to compare the difference between critical thinking skills between students who are taught through inquiry in University A and those taught through traditional teaching methods in University L, an independent t-test was calculated to determine this significance. And as we can see, there were statistically significant difference with the deduction ability, with the students' deduction ability, observation abilities, credibility abilities, assumption and meaning abilities at p-value less than 0.05. However, there was no significant difference at the level of induction abilities at p-value less than greater than 0.57. Hence, the results of the study revealed that students who were taught using IBL shows higher grades in the Cornell critical thinking test. And this can be very clear here when we see and we compare the means of the two groups. The means of the students taught through inquiry is higher than the means taught through traditional teaching methods. However, if we go back and we look at the manual of the Cornell critical thinking skills test, these both results are considered in the low range of critical thinking skills. This is why the researcher decided to continue investigation and do the qualitative method in order to ask the head nurse departments and the chairpersons in several nursing institutions about their perception towards students or nursing students if they are good critical thinkers, and their answers was that nursing students in nursing institutions, they lack the thinking abilities. The results of the difference between students who are taught through inquiry and those taught through traditional teaching methods come hand in hand also with the previous studies like Duran and document 2016. They stated that the levels of critical thinking were higher in the experimental group where students were taught with inquiry approaches, and the same was Hyun and Kim 2015. The results of their study shows that most of the subdomains scored were significantly having higher scores in the active learning approaches than those in traditional teaching one. As a conclusion, since the results of the study revealed that 70.5% of the samples of 158 nurse educators in Lebanon are not performing activities that is related to IBL because they are facing many challenges at the micro and macro level, and since the results also revealed that IBL enhances critical thinking skills, nursing institutions should be aware that their students are only recipients of knowledge. because they do not know when and how to apply this knowledge, because they are not taught how to think and act in a way through using their observations and experiences. Since 77.53% of nurse educators are willing to use IBL and 78.37% are connecting to the world of work, there is a need of introducing pedagogical strategies and methodologies to boost the students' critical thinking skills. As students, they need, or as nurses, they need to think critically, to analyze all the patient's information in order to make the proper decision and to improve the patient's outcome. And finally, the recommendations. Nursing faculties should encourage the notion of student-centered teaching and create a culture that focuses on preparing 21st century students through integrating innovative teaching strategies such as IBL. Every nurse educator should receive proper educational courses as well as training sessions on active teaching methods, which helps consequently identify and adjust their learning approaches, methods, teaching techniques, and strategies. Nursing faculties should use critical thinking assessment tools regularly and do not only consider the written exam, the student's mains assessment tool. The upcoming curriculum should not be designed as a subject-centered curriculum only. Thus, proper educators should be assigned to design the curriculum, and people aware of the subject material should ask, what is nursing? What are the needed learning objectives? What are the needed learning outcomes? What are the needed goals? What are the needed activities that allows educators to understand better the content? What are the materials needed to apply these teaching activities? They should all emphasize on these questions before designing the curriculum. These are the references, and thank you for listening.